Hello and welcome to the Glaucoma channel. This video is about glaucoma laser treatment. In this video I'm not going to explain what glaucoma is or the different types of glaucoma, because that has been done much better than I could possibly do in other very professional videos that are on YouTube. But first I'd like to say that I'm filming this in close-up because it is a video about eye problems, and I wanted you to see my eyes as clearly as I possibly could. And secondly, I apologize for the amateurish quality of the filming. I'm just filming on a very basic smartphone, and I'm using a very basic app as well to do some editing. I know the thought of having somebody drilling holes into your eyeballs with a laser is pretty terrifying. I know for me it really totally spaced me out. But I found that the thought of the surgery was a lot more terrifying than the reality. And if you're watching, you may have many fears about having this surgery done. So I hope this video will help to allay some of those fears. Now, there are many advantages to having holes lasered into your eyeballs. For one thing, lots of people will be asking you out to dinner because they'll want to know all the gruesome details after you've had this surgery. I should add that the hole that's the very tiny microscopic hole that's lasered into your eyeballs is towards the top of the eyeball, and it is covered by your upper eyelid, and it's probably going to be a great disappointment to people who invite you out to dinner. They'll want you to raise your eyelid so that they can have a look at this hole, but it is so microscopic that it can't be seen. But of course, don't tell them that, because you want a free dinner. The second plus is that it will cure your glaucoma symptoms in most cases, and you'll be able to get on with your life. So I'm going to go through what happened to me, and hopefully when you finish this video you will feel less fearful. To begin with, I was lucky in that I had a member of my family who had glaucoma, so I looked up the symptoms a long time ago. And one afternoon, my right eye suddenly became very foggy, and I knew straight away what it was. Now, the type of glaucoma that I had was the type that suddenly appears with symptoms that may last for an hour or two, then the symptoms disappear and may go away for a week or a month. And this is a very dangerous type of glaucoma because people then think, oh, it's something only temporary, it was just some aberration, and I won't bother dealing with it. Meanwhile, the glaucoma is doing all kinds of damage to the retina and to the retinal nerves. So it's very important when you have any symptoms with blurred vision or a mistiness in your eye that you go straight away to an eye hospital and get checked out. So I got to the emergency ward of Moorfields Eye Hospital here in London as quickly as I possibly could. And the staff at Moorfields are absolutely fantastic. Now, I had to wait a while, of course, because there were other people with very, very serious eye injuries in the emergency department. But eventually I got in, and I was seen by a consultant, and he diagnosed glaucoma straight away. And he gave me drops to keep the pressure in the eyeball low. And then he made an appointment for me to be seen at 10 o'clock the next morning at the Glaucoma Clinic at Moorfields Eye Hospital. That was, in my view, wonderful service. I arrived at the hospital the next morning, and I was greeted by a nurse who actually took me to the clinic. And I cannot praise the staff there enough for all of their help. The emergency staff and the staff at Moorfields Eye Hospital in the Glaucoma Clinic saved my eyesight. At the clinic, they did all the tests. I was there, I must have been there for 4 or 5 hours, having test after test after test. Wonderful Professor Foster, the head of the Glaucoma Clinic, advised me that although I only had the symptoms in my right eye, he intended to have his staff do the laser treatment on both eyes, because he was quite sure from his vast experience of dealing with this type of glaucoma that the condition would probably arise in my left eye as well. And then they gave me more drops to keep the pressure in my eye low. And then I was put on the list and in the queue to have the glaucoma laser treatment. Several weeks later, I was called back to the Glaucoma Clinic to have that laser treatment. When I arrived, the first thing they did was try to reassure me, because I did make sure that they knew that I was very anxious and very fearful. So the nurses there were wonderful. They tried to reassure me. They put drops in my eyes. Then they also put anesthetic drops in my eyes. So there would be no question of me having any pain whatsoever. So I had to wait while all of that took effect, and there were other people there in the clinic as well, and it is wonderful to have other people around you who have the same fears, and you can it's always great to be able to discuss your fears with other people who are just as afraid as you are. And then eventually, after a couple of hours, when all of these drops had done their work, I was called into a room where they have the type of machine that's used to examine eyes. If you have eye problems, then you've had that done. You know, it's got a microscope on it that looks into the eye, and there are lights that shine into the eye, and you press your forehead against the bar and your chin down on the chin rest, and they look into your eye. Well, it's exactly the same type of machine that's used. But in this case, there is a small laser attached to it. It's like a pen with a lead, an electronic lead. And it's also fixed to rotating wheels that the technician, the doctor, can move these dials to get the laser into the exact correct position. They put you into this machine, you put your chin down onto the chin rest, you stick your head against the forehead bar, and you're told to keep your head very still. Now in some clinics they also put a strap around your head that's attached to the machine so that there's less chance of you moving your head. In this case, I must admit, I was a bit worried about the fact that there was no strap, and so I had to make absolutely sure that I kept my head absolutely still. But the benefit of that was that when I was thinking about keeping my head absolutely still so I didn't have my nose lasered off, I wasn't thinking about really anything else that was going on. I was just focusing totally on that. They then take a glass. It's something like a very small whiskey tumbler. It's a thick piece of round glass, and it has a tunnel, a hole in it. And they hold your eyelid open, and they put the glass right against your eyeball. And you can't really feel it, or there's no real discomfort because your whole eye is completely anesthetized. You can't feel a thing. And the laser light goes right through the open channel in that very thick glass tumbler. So you're not going to have the laser light moving about across your face as I was terribly frightened of. Instead, the laser light goes directly through that tunnel, and the technician who is doing this job every day, day after day, and really knows what he's doing, positions that tumbler in the correct place, and your eye is held open like that. You've got this glass tumbler over the eye, but you can't, over the eyeball, but you can't feel it. And then he takes the laser pen and he holds it in position. He puts it in position using the various dials, and then when he has it in exactly the right position, and it's going to be at the right depth and so forth to make this very microscopic little hole, there's a red light, and he tells you to keep your eye focused on that red light. And you just focus your eye on the red light. He presses the button, you hear a slight zapping sound, and that's it. That's your laser treatment done. The laser light is only on for 1 second at the very most. And then you have a minute to collect yourself, and while he readjusts the machines, and then he moves you around a bit, and you do it with the other eye. Now the whole procedure took at the very most 15 minutes, even less probably than that. And that was it. And then I was sent off to sit for a while and just compose myself for about half an hour. And then I was brought back in again, and another doctor, another technician, examined my eyeballs to make absolutely sure that everything was 100% correct, that what they were really looking for was to see that the hole that had been lasered was the correct size. And as I say, it's absolutely microscopic, but it's large enough for liquid to come out through to allow any pressure that builds up to be released in the eyes. So that was it. Now, I had been warned that obviously when you have holes lasered into your eyeballs, this is a major shock to the eyes, and after the anesthetic, the painkillers that I'd been given had worn off, there was going to be pain and discomfort. And I can't lie to you about that. That is true. It was a great deal of discomfort and not high-level excruciating pain, but mid-level pain, like somebody had, punched you in the eye, and you were recovering from that. And really, all you wanted to do when the anesthetic began to wear off was just keep my eyes closed. There was a feeling of grittiness as well. And that took about 3 or 4 days to go away. And I had to spend that time just sitting on my sofa, basically with my eyes closed, not doing much of anything. So I found that it wasn't the treatment itself that I should have been anxious about, because the people who are doing the treatment at Moorfields Eye Hospital are so experienced, and they know what they're doing, and everything worked perfectly. It was the after effects that I hadn't really thought about. I didn't realize just how painful it could be. But gradually, over a week, by the end of a week, it was fine. I was getting much better, and there was no swelling. I didn't have black eyes, or my eyelids weren't swollen or anything like that. It was just this feeling of pain and discomfort in the eyeballs that I was feeling. But then within a week, everything got better, and then within 2 weeks, I wouldn't have known that I'd had anything done at all. So I hope that allays many of your fears about having this treatment done. When I used to go back to the clinic to have the examinations on the eyes to see that everything was going along smoothly and that there were no complications, I sometimes used to be sitting in my little examination cubicle, and I could hear one of these wonderful consultants at Moorfields Eye Hospital trying to persuade a very fearful patient that they really must have this treatment done, this laser treatment for glaucoma. And the person was saying, no, I'm not going to have it done. And they were giving the consultant all kinds of ridiculous reasons why they couldn't have it done, why they didn't want to have it done. But they didn't want to admit that they were afraid. Just simply that they were afraid, that's all. And it was very sad to see. Here in Britain, we're extremely lucky. We have a National Health Service, and this treatment is offered to glaucoma patients completely free. I did not pay 1 cent for that treatment. All of it was paid for because I have many, many decades of paying my national insurance contributions. And yet, patients who can have this wonderful treatment done for free are not having it done because they're afraid of the idea of holes being lasered into their eyeballs. So I hope this video helps to a certain extent. The only other thing I would add is that there is one complication from this laser treatment for glaucoma, that in some cases the hole that's been lasered into the eyeball grows over and closes off, as it naturally does with the body. If you get a cut on your arm, the skin grows back. In some cases, but I gather I'm not sure what the percentage of, but I don't think it's very high. So in some cases, the treatment doesn't work because the person's body is making the hole close over and grow over. But I hope that gives you some idea of what I've been through and what you may have to go through in having this laser surgery. I hope you enjoyed my modest little video. Now is the time when most YouTubers will be asking you to press the like button and also to subscribe to their channel. That's the way to go up the Google and YouTube search engine list. But to be quite truthful, I'm not interested in such things. I'm chasing other gods. Instead, if you've enjoyed this video, it would please me much more if you would just be kind to elderly people. Do a little kindness for someone who's partially sighted, like myself, or someone who's blind, or someone who has learning difficulties, or someone who has balance problems, as I do. Just do a little kindness for somebody else, especially for us over 60s. I'm in my mid-70s. That would please me more than pressing the like button or subscribing to my channel. And I'm very sure that it would also make you feel much better about yourself.